con la participación de todos ustedes. Sigue entrando todavía gente a la sala de Zoom, pero vamos a comenzar este webinar que se llama Compartiendo lecciones aprendidas en la reducción del embarazo no intencional en adolescentes en América Latina y el Caribe, reduciendo las inequidades en el acceso a los métodos modernos de anticoncepción. Esta
A todos y a todas, bienvenidos y bienvenidas a este webinar. En nombre de la OPS estamos muy contentos de que este se esté llevando a cabo y que estén participando ustedes. El embarazo en la adolescencia tiene grandes repercusiones en la trayectoria de la vida de las niñas y de sus familias. Además de afectar su desarrollo psicosocial, contribuye a resultados precarios en materia de la salud para las niñas y sus hijos, repercute de manera negativa en sus oportunidades educativas y de empleo, y contribuye a la perpetuación de los ciclos intergeneracionales de la salud precaria y de pobreza. En el transcurso de la última década, las políticas y programas para la prevención del embarazo en la adolescencia adquirieron una importancia cada vez mayor en las agendas nacionales de la salud y del desarrollo. Si bien es cierto que existe un consenso en lo que respecta a las acciones necesarias para prevenir el embarazo en la adolescencia, algunos países aún se encuentran enfrentando importantes desafíos en el proceso de transformar las políticas y programas en iniciativas de gran escala. Tal como se indica en la meta 3.7 de los Objetivos de Desarrollo Sustentable, para poder disminuir el embarazo no intencional en la adolescencia es indispensable garantizar el acceso universal a servicios de salud sexual y reproductiva, incluyendo servicios de planificación familiar, información y educación, y la integración de la salud reproductiva en las estrategias y programas nacionales, con un énfasis particular en el primer nivel de atención. Evidencia sólida y las mejores prácticas a nivel mundial y regional indica que sí es posible hacer frente de manera exitosa al embarazo en la adolescencia si existe un compromiso político necesario y se realizan inversiones estratégicas en abordajes basados en la evidencia. La disminución del embarazo en la adolescencia exige una inversión en la salud, el bienestar y el desarrollo de la generación actual y de las generaciones futuras. Esta evidencia acerca de la prevención del embarazo en la adolescencia ha crecido en la última década. Ahora sabemos más
about the scope of the problem and its complexities and its differences in the different settings, and also as to the effective actions to prevent adolescent pregnancy. So the efforts so far have used actions to raise awareness and to provide education on sexuality and long-action contraceptives. However, we must also act to improve the access to healthcare and to help the adolescents go back to school or to find a job after the pregnancy. And these elements have been not so emphasized. The Pan American Health Organization is committed to help the member states to promote health and well-being of our adolescents in a comprehensive approach to ensure that not just that they survive, but they may also thrive. The reduction and prevention of adolescent pregnancy is a priority for us. We need to protect our achievements and reinforce our commitment, ensuring that the young girls and boys may have a timely information access and sexual and reproductive health, including the modern and long-action contraception. In the context of the interagency joint work, both PAHO and UMPA have supported a number of activities celebrating the week of adolescent pregnancy in Latin America and the Caribbean for the first time this year. The COVID-19 pandemic has not distracted us. Rather the contrary, it has focused our attention in doing our best not to lose any steps forward achieved in recent years.
We celebrate with UNFPA 50 years of life of the Latin American Center of Perinatology, CLAP. It's a center committed with the improvement of the health of women and newborns in our region. With this, I finish and welcome you again to this very important seminar. Thank you very much. Rodolfo, you have the floor again. Thank you, Dr. De Francisco. Now, on behalf of the United Nations Population Fund and on behalf of the Vice Director, Dr. Floribela Fernandez, we shall hear Dr. Virginia Camacho, Regional Advisor in Sexual and Reproductive Health of UNFPA in Panama. Good morning to all of you, dear representatives, ladies and gentlemen from the governments in the region, dear colleagues in the United Nations system, particularly Andrés de Francisco, representing the Pan American Health Organization, World Health Organization, Dr. Suzanne Cerullia, CLAP Director, and other sister agencies in the UN system and international agencies, young people participating in this virtual seminar, representatives of civil society organizations and academia. First of all, we want to say or express our solidarity with the peoples of Honduras, Nicaragua, and Central America because of the hard times they are undergoing due to the presence of the ETA hurricane in that subregion. I also want to excuse Floribela Fernandez, our regional assistant director, who, because of reasons beyond her Will could not participate today. She sends her greetings and wishes the best for this conversation. So on her behalf and on behalf of our regional director, Mr. Harold Luke Robinson, I wish to give you all a very warm welcome to this technical seminar. I wish to thank your participation that has been organized on the one side and the framework of the celebration of the 50 years of the Latin American Center of Perinatology, Women's Health and Reproductive Health, CLAP, which for decades has been a reference of maternal and perinatal health in our region. I wish to take this chance to pay homage to its founder, Dr. Roberto Caldeiro Barcia, an illustrious physician and scientist of universal character and a teacher for many generations. Congratulations, CLAP. Congratulations, Paco. In this context, the seminar is also part of the joint work which, together with the Pan American Health Organization and other strategic partners, we have been developing in the prevention and reduction of teenage pregnancies, which for our region remains a serious public health problem, one of the most important challenges for development and the full exercise of sexual and reproductive rights of teenagers. In these difficult, challenging times, and UFPA, together with PAJO and CLAP, have prioritized the organization of this space, whose purpose is to reflect, share experiences and lessons learned to do it jointly regarding the prevention and reduction of teenage pregnancies. This has enormous importance so as not to go backwards, to maintain and to deepen and try to move forward in terms of the goals and objectives that were agreed upon intergovernmentally, particularly those arising from the International Population and Development Conference, Cairo, 1994, which were approved by the UN General Assembly in 2014 and strengthened and enlarged in the Nairobi summit that took place last year, but most especially to advance in those established in the Montevideo Consensus, the most advanced progressive agreement at the intergovernmental level on this subject at the regional and world level. I also wish to place this conversation in the context of the COVID-19 pandemic. We are aware that sexual and reproductive health vulnerabilities and the vulnerability of rights have also increased. Besides the well-known risk factors and social developments that the Montevideo Consensus in 2013 stressed in its priority measures, we must now add these other ones, or the ones related to the pandemic increase. So the main question we have as UNFPA, together with our partners, is what to do. We must go on gathering efforts in order to stop this move backwards, to make a joint commitment to guarantee the continuity of sexual and reproductive health services and comprehensive sexual education and empowerment of girls and adolescents. We must all define a set of those with a strategic criterion in order to minimize the impact in the access to health services and schools. So we do not have time to waste. That is why it is so important to improve our response to these challenges. We consider that together with the Sustainable Development Agenda 2030 as a guide, we must improve our efforts and guarantee that girls and adolescents do not fall back. We cannot allow the present crisis to derail the future of a whole generation. We invite you all to double our efforts. Once again, we thank you for your participation in this regional conversation, and we are sure that we will learn a lot from one another. Thank you very much. Thank you, Dr. Camacho. We now give the floor to the director of CLAP and head of the Women's Health Unit, Dr. Suzanne Cerullia. Thank you very much, Rodolfo. Thank you very much, Vicky, for your words regarding CAP. Andres, thank you for opening the meeting. We are very happy. There are many of us here in YouTube. We have 3 languages going, Portuguese, English, and Spanish. And we are celebrating, in one of the webinars, there will be 5, we are celebrating CLAP's 50 years. The center has been working for decades so that in the coming years, we may have healthier lives and more social development. And how do we get that? We get that if we give every woman the opportunities that they deserve, newborns also, the opportunities they deserve, with evidence-based work and work based on human rights and humanization of care. We know that this work of avoiding teenage pregnancies has gigantic repercussion. You will hear from the countries today in the generation of more social development, in the generation of more rights for adolescents. So I wish to thank each country for presenting their advances and why it is so important to do so, and why are we still working on that? Because even in this context of pandemic, with so many uncertainties, with so many problems, we want to go on working so that we keep advancing. Thank you very much for having all of you here. I wish to invite you to the other webinars. We shall be performing 3 more webinars on C-sections and all the other activities that are important for birth. We shall have a very important discussion on infodemia regarding pandemia. We are all covered with information. It's important to understand how to do this, and we shall finish the 5 seminars celebrating CLAP's 50 years with our main asset, the perinatal informatics system, which has now shown the importance it has at times when we need good information, so that through that good information we may implement the best evidence and the best care. I now invite you all to watch the video that's called Clap Towards the Future. Thank you very much.
Imagino que todas las madres y los niños van a tener una posibilidad mucho mayor de ejercer los derechos que tanto proponemos y deseamos. Que los embarazos sean deseados y planificados en virtud de lo que venimos trabajando, que va a haber una importante reducción en la mortalidad de causa prevenible. En ese sentido, en ese vínculo y diálogo entre la evidencia científica y la generación de políticas, creo que el CLAP es donde ha tenido y va a seguir teniendo una incidencia muy importante.
O grande desafio seria ter para 2030 alcançar não somente no promédio do país, mas também ao interior de cada país, em cada província, em cada estado, para cada grupo populacional, ter a mortalidade materna por debaixo de 35. Isso eu creio que seria logro muito importante para a saúde e a qualidade de vida da região. O compromisso político de los governos, com a participação das sociedades, das comunidades e com a cooperação técnica, com todas as ferramentas técnicas que temos para apoiar esse proceso.
La vocación de CLAP es cuidar. Lo que nosotros hicimos durante 50 años y queremos hacer mucho más es cuidar a las mujeres y a los recién nacidos. ¿Y cómo se cuida bien? El cuidado va desde la promoción hasta la vigilancia y a la atención de la salud. Se cuida bien con buenas prácticas, con humanización de la atención y con el uso de la innovación tecnológica. Es a eso que nos dedicamos hoy y los días futuros lo pedirán. que seamos cada vez más innovativos, pero que siempre pongamos en primer lugar la atención humana a cada una de nuestras mujeres y recién nacidos.
Com pedrinhas de brilhante, para o meu amor passar. Se eu roubei seu coração, é porque tu roubaste o meu também. Se eu roubei teu coração, é porque te quero bem.
Thank you very much for sharing this video. I'm now honored to introduce the presentation that will be shared between Dr. Vicky Camacho, Regional Advisor in Sexual and Reproductive Health of UNPA, and Sonia Cafe, who's coordinator of the Adolescent area in Pajo, Washington, D.C. You have the floor. Thank you. Thank you, Rodolfo. Once again, good morning. I have several hats today, but together with Sonia, we have prepared this presentation whose objective is just to present some aspects in order to start a conversation that is more interesting than this, that will be this dialogue that we shall have with our panel members today. I will start, and I hope you may see it. I don't know if you can see my screen. Can you see it? Yes. Thank you very much. Then
to do with the fecundity of girls under 15. And it's what we see in girls, and we see that there's a trend to increase. We don't know whether this tendency to increase is because we are better recording the data or because we have seen an increase in cases in some countries as to the fecundity at this age. We know that the pregnancy is not common in this age group. Motherhood at this age occurred because of early intercourse or early marriages, or because of unprotected sexual intercourse or sexual violence. But in most cases, there is sexual violence. There is an important under-recording also. And the truth is that, on the other hand, it's a pregnancy that is usually hidden because for some people, this implies stigma and shame, especially by those who caused pregnancy. Most countries in the region have birth rates from 1 to 5 for every 1,000 girls from 10 to 14 years of age. Venezuela would have 5 births per 1,000, and Dominican Republic 2 births per 1,000 of girls that age. This is something that we'd like to highlight, and it is that the specific fecundity rate in adolescents in the region represents this reduction. We also have good practices with objective reductions of this rate between 15 and 19 years in the region. Now we're going to listen to countries that have documented this reduction. In the region too, the number of unintentional pregnancies in girls from 15 to 19 years of age, according to Guttmacher's last is of 2.6 in every 1,000. And among the women that want to prevent pregnancy, the unmet need is greater in adolescents and in women from 15 to 49 years of age, according to Guttmacher too. Something that we have, that we consider absolutely important now is that although the regional average, we see that there's a trend, a slower trend in some countries. In other countries, it's been more significant to see that reduction or a trend in reduction. The inter-country inequalities continue to be the core element of adolescent pregnancy, and this is what we need to pay attention to if we really want to achieve equity. This is ECLAC. This is from 15 to 19 years of age by race and ethnic group. And you see that in Afro-Americans, this is in brown, and in orange, the non-African descendants, and you see the difference between the two groups, and we can see you see the inequalities and how the African descendants is highly affected. However, among in the non-African descendants, we don't have the indigenous groups or the cases where the ethnic group, the ethnicity or the race are not specified. So now with ECLAC, we are conducting work on that among the indigenous. This is in Peru. If we analyze adolescent pregnancy by inequality stratifiers, we see that the big differences are in the rural areas. This is Peru, notice 22.7 versus 10.1, rural and urban, and also by educational level. There's a very significant difference. And we can see, for instance, these girls, 35% that reached only just finished primary school, and they are mothers already. And look at this, 6.7% that are girls that haven't yet finished primary school and are already mothers. We think that we also need to consider poverty, and this is a very strong factor. The pregnant, the mothers by quintiles, poverty quintiles. According to the UN, a key issue, it has to do with poverty. And this, and the strength of being poor and the risk for pregnancy is very strong, both for pregnant women from 15 to 19 years of age and to those under 15 years of age. So the determinant, poverty as a determinant, is closely linked to adolescent pregnancy. This is information from Nicaragua, and here you have the adolescent fecundity. And although we see that there is a trend downward, that drop has been too slow. And here you can see some proportions, and we see that there's an increase among girls from 10 to 14 years, according to the latest data. Now, something that is very strong is the fecundity rate in girls with no education. Notice the median age of the first intercourse, 15.8, and so early intercourse and the beginning of sexual life, and the median age at the first birth, 17.4 for girls with no education, versus the rates at high school and tertiary education. Another important determinant for a pregnant adolescent is gender-based violence, especially in girls from 10 to 14 years of age. Here, this is a study that was conducted in Colombia, and here you see that out of 14,000 girls who suffered some kind of violence in 2019, 71% corresponded to sexual violence. And the effect, an adverse effect of unintentional pregnancy among women is maternal mortality in adolescents. This is Paraguay for 2013-2018, where mortality, maternal mortality, both in absolute numbers and in shares among adolescents, is 22% among all women. And you can see here from 2013 to 2018, and you can see that it is very important that there are many cases of mortality, maternal mortality in girls under 20, and the leading cause in 2018 of maternal mortality was of unsafe abortion. Another study by Guttmacher a few years ago is something that worries us. It's unplanned births, unplanned pregnancy in our region is greater than in other regions in girls under 15. We could compare, look at this. Latin America and the Caribbean, unintentional pregnancy in girls under 15 is 65%. If we compare that with Asia, Africa, and other developing regions, you see that we are 3 or 2 times as high. And why does this happen? First of all, because they have more barriers to access to contraception. There's a significant case of coercion, sexual coercion or sexual violence. So they start their sexual life earlier. And today with COVID-19, it's even worse because of the isolation and with girls that have to live together with the perpetrators. This is something that we need to pay attention to in the region. We also wanted to share the impact of COVID in the region, and we know this is a study, this summarizes a study by UNFPA that was just published, and the impact of the pandemic, according to the study, is greater for girls and adolescents than for adult women. Something that we'd like to highlight here has been the introduction of primary care services, including consultancy, advice, access to contraceptions, difficulties to have access to healthcare services, sexual reproduction services, or because of economic reasons, or because in many countries in the region the services were closed. However, as you see, this has an unequal impact on the different groups of the population. The pregnancy rates among adolescents in the region may increase much more in more vulnerable groups, such as the ethnic groups, rural populations, people living in a humanitarian context, the poorest, and the people with discapacities. Disabilities. And according to UNFPA, the closure of schools has had a specific impact on adolescents with on almost nil access to information and to sexual services, and with the increased risk of sexual violence. the study shows that in the scenarios studied, COVID-19 may represent a significant step back in the achievements of the reduction of adolescent pregnancy in Latin America and the Caribbean, with an increase of the specific fecundity rate. So far, we have, as I showed in the first slide, a fecundity rate of 60.7 per thousand of adolescents from 15 to 19%. According to the study, our projections show that there would be a drawback. We would go backwards and to have a rate of 65 per thousand live births. That was the rate estimated for 2050. So this study too, by Milena in 6 countries in the region, analyzed the cost of adolescent pregnancy for countries and for people. The opportunity costs were calculated in 6 countries in the region. One of the elements was the educational gap. What they saw was that the women that had children in adolescent were 3 times less likely to get a university degree. As to the income gaps, these women gained 24% less as an average as the counterparts. As to the labor gap, they were more likely to work in domestic work, and the medical costs associated with the care of pregnancy, the complications, and for the governments, the loss of revenues. So this is a survey conducted by WHO as to which were the services that were interrupted because of COVID-19, and you see that family planning was one of the services that suffered the most because of COVID-19. That is, access to contraception. It's much more than the care at childbirth or antenatal care, although PAHO showed that it had been reduced by 40% in 10 countries in the region during the quarantines. However, we analyzed the situation in each country, and we identified, for instance, in the Dominican Republic, that antenatal coverage is much lower still if the pregnant woman is an adolescent, and the same occurs with the access to contraception, and it ranges from 30 to 96% disruption in the primary healthcare services. Therefore, the challenges that we faced before COVID-19, before the pandemic, as to the determinants and the risk factors of pregnant adolescents, I think that it is important to highlight that they are worsened with COVID.
Although in the policy area, we have regional policies and world policies, we have the Sustainable Development Goals, the Montevideo Consensus, we have strategies to work in an interagency group at the regional level, the WETLAC, which has a focus on this effort, and we also share it with the World Health Organization, the Pan American Health Organization, UNICEF, World Bank, IDB, etc. I believe that the focus of this work should be to close the equity gap, has to be an effort to decrease health inequities. The other element is not to leave anyone behind. So we have to stress reaching those populations living in conditions of greater vulnerability. Before the pandemic, and now more, we had many challenges regarding access and universal coverage of sexual and reproductive health services. Therefore, this is an area where we have to deepen and strengthen efforts at the country levels, not only at the country levels, but at the field level. Key interventions are not reaching, such as comprehensive sexuality education, access to advisory and contraceptive services. Today, during the pandemic, several countries are implementing some models of care using digital media, to close these coverage gaps, I believe we have some good practices that we should systematize, but not in order to do this only during the pandemic, but to include them in our efforts to expand coverage, extend coverage through innovative means that allow us to reach people, and particularly the younger people. And monitoring and assessment is a very important area of work. And the baseline of teenage pregnancy, according to inequity stratifiers, we are now working in the WEC framework and with PAHO, UNFPA, and the Central American countries. We are making an effort to build a baseline on teenage pregnancy and inequity. So if we do not have adequate action recognizing the fact that there are countries that have made important progress in recent years in the decrease of teenage pregnancies, the COVID crisis threatens the progress made in the prevention of teenage pregnancy in our region. Thank you very much, and we invite you all to act now. Thank you very much, Dr. Camacho, for the excellent presentation prepared together with Dr. Sonia Cafe. Sonia, would you like to make any comment?
No, thank you very much. Thank you, Vicky. I think everything was said. And so, as we mentioned in the beginning, this is a dialogue, right? We want to dialogue with people who have experience in the field. And so if you allow me, Rodolfo, without further ado, I would like to introduce the person who will facilitate this dialogue as a next activity in this webinar. And so it is with great, great pleasure that I introduce a very strong and powerful young woman. As you know, we always say we want young people to participate. We want young people to be an integral part of everything we do. And so we want to give space to young people to also co-moderate and lead. And so I would like to present Leah Ceballos. Leah is a member of the group Ashanti Peru, which is a network of Afro-Peruvian youth. And important, Leah is also a member of the PAHO Youth for Health group. So please, Leah, take it away, and we invite you to moderate the panel discussion. Thank you.
Thank you very much, Dr. Sonia, for the invitation. I am very thankful to PAHO and UNFPA for their support in this session. It's very important for me. It's an honor, but also a responsibility to be able to guide these lessons learned and advances and lessons that are still pending regarding the decrease in teenage pregnancies in Latin America and the Caribbean. First of all, I would like to say that despite the socioeconomic growth in recent years in Latin America and the Caribbean, fecundity rate in the region remains unacceptably high, and this is the second highest in the world, with important inequities within and between countries. Girls and adolescents in families with the lowest incomes have the lowest levels of education. Indigenous and Afro-descendant communities are more affected in a disproportionate manner by unwanted pregnancies and unintentional pregnancies in adolescents. And today we have a group of panel members and experts to analyze reality, to learn from advances, and also make some contributions that will be of inspiration for all of us. Our guests will have 4 minutes to respond to some questions and thus start a dialogue so as to have time and space for reflection and questions from the public, ministries, civic and academic society, and youth leaders. First of all, I would like to introduce Silvia Ramos on behalf of the Plan of Unintentional Teenage Pregnancy Reduction Plan in Argentina. Thank you very much. Good morning to everybody. It is a pleasure for me to participate in this club birthday. celebration, so I'm very thankful to be here sharing this activity with you. I will respond to the question that was set to me, saying that ENIA plan, whose coordinator I am since the beginning, was developed in 2017. In order to do that, we analyzed the determinants of unintentional pregnancy in Argentina, and also the existing evidence and experiences regarding effective interventions to prevent it. That is how we designed an intersectoral plan that brings together the ministries of health, education, social development, and more recently, the Ministry of Justice and Human Rights has also been incorporated to provide free legal advice to girls. The theory is based on 4 main issues: comprehensive sexual education in schools to sensitize and train teachers on contents of sexual education with an emphasis in contraceptive methods so that they may convey to their students those contents through different types of activities in the classroom, and these teachers are accompanied by pedagogical advisors who provide technical permanent assistance for planning activities. The second device is advices in comprehensive health by advisors that have been trained by the plan, who respond to questions from students in individual sessions and also in workshops based mainly on sexual and reproductive health, and they also refer when necessary to the health services. This device also works in community spaces to provide the same type of answer to the adolescent population that is not in school, which unfortunately is a large proportion in Argentina as in the rest of Latin America. The third device is advice in sexual and reproductive health and the provision of contraceptive methods with a stress in long-term subdermal implants and IUDs, always emphasizing double protection that we know is necessary. And finally, the fourth device in the plan is what we call incidence days for the intersectoral approach to sexual abuse and forced pregnancy, which mobilizes institutional actors locally in order to identify the bottlenecks in the protection of rights of abused children and girls and with forced pregnancies. And we align visions on the problem and different solutions. We all know that sexual abuse and coaction are the determinants that are very hard on unintentional pregnancy in teenagers, particularly below 15 years of age. And although the legal framework in my country and many countries in the region allows legal abortion in these situations, responses of institutions are very poor or non-existent. With these 4 devices, plus other actions complementary to these, the plan has not only managed in the past 2 years, including the pandemic, to have more teenagers having access to sexual education, to more information on sexual and reproductive health, and to have better access to contraceptive methods, particularly, I insist, long-acting ones, which protect them best, but also it has achieved, and I think this is particularly important to stress, that educational and health and social protection teams are strengthened as agents of change. As to the challenges, which was the second question that was posed to me, future challenges are many, but I would like to stress 3. In the short term, the first challenge is to recover from the emotional shock that the pandemic has imposed on us, with all that means to learn to live together and to adapt many interventions to this new context. The second one, and for that we need lots of creativity and patience. The second challenge is operational, and it is to implement virtual advisory sessions through WhatsApp. We have developed them in order to respond to the restrictions by the pandemic. And there are some things that come together with the ill events, and yet they are good practices. And we think that they have come to stay. In this case of Argentina and our plan, virtual advice were an improvised response, perhaps, to the pandemic, but we have worked on them and we are launching them as a new modality of the advisory device. And the third strategic challenge of the plan is to maintain our mystique, which fortunately has been achieved because, as we all know here, complex interventions, as they should be, those oriented to the prevention of unintentional pregnancy in adolescents, which has multiple determinants and must have multiple responses. They need committed agents, committed state, educational, health, social protection agents that are committed to the work and with the competence and personal abilities well developed, but it also needs innovative state capabilities. And for those two things to happen at the same time, we must to create a mystique, a feeling of belonging, and a capacity of response by the state in order to respond to all the problems, as Dr. Camacho has shown us, although things have improved in the region, and that includes Argentina, but still we need to intervene far more decisively and in a more sustained manner to revert gender inequities and social inequity and violation of basic rights of girls and teenagers that are not in agreement with the expectations and dreams of teenagers for their lives that as adults are responsible to contribute to improve. Thank you very much. Thank you, Silvina. Although ENIA plan is an important innovation of the Argentinian government, it has also inspired many countries. Thank you very much for your valuable contribution. We now wish to introduce a second guest who represents the University of the Republic in Uruguay. She is the professor, Alejandra López Gómez. Welcome. We know that Uruguay has had a significant decrease in teenage fecundity in the recent years. From the studies carried out by you, which are the three main interventions that have contributed to this decrease, and what are the pending challenges?
Alejandra, your mic is off. I'm sorry. Yes, we rehearsed it so much. First of all, I wanted to endorse my support and my compliments to this celebration of CLAP and my warmest congratulations for such an important date. And I want to really thank you for inviting me to participate in this webinar. Now, going directly to the question in 4 minutes, very quickly. Yes, indeed, Uruguay has experienced the so-called an accelerated drop of the overall fecundity in the last 5 years. And it happened basically from 1.96 to 1.59. And this significant drop between 2015 and 2018 of the fecundity in the Uruguayan population can be accounted for to a certain extent, to a good extent, because of the drop of adolescent fecundity. Just to give you an idea, in 2018, 2019, in Uruguay, it was 36 per thousand. The rate, there was it had remained in 60 per thousand for a long time, and it wasn't until the last 5 years that it reached 36 per thousand. Now, the questions that follow are, which are the actors, or what are the key interventions that could have led to the significant drop in fecundity? And I'd like to highlight especially three. I want to highlight three, although of course, and in all complex issues, there are different levels of intervention. So first of all, it's a long-standing process. Although we saw the effects in the last 5 years, actually the process began with welfare policies in the Uruguayan population, and also the gender agenda and the agenda of the sexual and reproductive health were highlighted. And but if even before the 21st century, Uruguay had started a number of very significant policies related to sexual and reproductive health. And I'm going to mention three that were developed in the last 15 years, essentially related to the recognition of the sexual and reproductive health as human rights by the Uruguayan government, the inclusion of sexual education as part of the syllabus at schools, and also the voluntary interruption of pregnancy that was a law that was enacted in 2012, that together with other laws ensuring equality and rights would form the rights agenda in Uruguay. So although we saw the results in the last 5 years, it actually had begun much earlier. And there was a key thing in this process that was the key policy makers in Uruguay recognized that pregnancy adolescent was a public problem in the country. It was a relevant problem related to social inequities and the many social gaps that were already mentioned that led to a stubborn 60 per thousand rate. So despite the policies, we hadn't seen a drop in adolescent pregnancies. And one of the problems that we had is that it was not seen as a problem. And there was a key thing that I want to highlight, because I think that this was one of the keys, and that was the virtuous link between public policy, decision makers, the UNFPA that was played a key role on these issues in Uruguay, and the role and the collaboration of the academia. This virtuous joint work among all these stakeholders has been key to provide visibility to this problem so that it would become a public policy issue, so it would be seen as a public policy issue. And third, in this period, we also saw a significant expansion and consolidation of the universal services for sexual and reproductive health, and in particular, they started delivering the subdermal contraceptive implants that became available in Uruguay as of 2016. So these are the three most significant things that I'd like to highlight. And I also want to tell you that we have significant challenges. There's one key issue in this process of construction of the problem of public policy, and that is the response, that is the national strategy, the intersectoral strategy for the prevention of adolescent pregnancy that was implemented in 2016 with it was an interagency collaboration with the international support and the academia to develop a number of actions and interventions that were novel, adding to the existing ones and adding to the strategy that was one of the relevant interventions in these last 5 years, together with the implants, sexual and reproductive health, and long-action contraceptives. So what are our challenges now? First of all, the implementation of the actions included in the national strategy. There's a key thing there that is pregnancy under 15 years of age. The strategy had a first period where they focused on 15 to 19, and a roadmap was developed and a flow chart was developed in girls under 15 that have very specific characteristics. So now it's time to implement that roadmap and that flow chart. Second, we have a challenge that has to do with the development of the sexual education policies, and more specifically, the development of policies for prevention and reduction of pregnancy among adolescents in the context of sexual education policies aimed at adolescent boys and girls that may help them in as they make decisions related to the topic that is core to the adolescents. And obviously, we have a key thing that has to do with the expansion, accessibility, a better institutional response as we deliver sexual and reproductive services to adolescents. All this as also with the effects of the pandemic and its impact on mental health and social and economic and society, and specifically on young people and adolescents that were the populations that were the least considered during the pandemic. And second, in the case of Uruguay, starting in March 2020, a new administration began in government that had to face a number of challenges because of the pandemic, and added to it. One of them was how to continue to work in the reduction of adolescent pregnancy, in expanding the rights and opportunities for male and female youngsters in our country, and not to lose any of the achievements in terms of sexual and reproductive rights. So we face a very challenging scenario, and we have a very good platform to move forward. Thank you. Thank you, Alejandra, for your contribution and for your valuable time. Let's also remind the rest of the participants to please not to exceed 4 minutes so that we may listen to all of our speakers. Our third speaker will speak English, so please activate, enable the Spanish, the interpretation. We have so we have the next speaker from Jamaica. Jamaica has a long-standing program for the prevention of adolescent pregnancy. It started with an NGO pilot plan, and today it has been expanded and funded. It's funded by the government. What are the main negative and positive issues that helped this program to be successful so that it could be upscaled? So Marian, you have 4 minutes to answer this question. Thank you.
Okay, thank you so much, Leah, and good morning, everyone. Okay, so since its establishment in 1978, the Women's Center Foundation of Jamaica, which is the program you're speaking of, has experienced a significant degree of success due to several interventions that it has started, but I'm going to talk about the 2 primary ones. So one, it has a focus on continued education of pregnant girls who have to sit out of traditional high schools until after their pregnancy. So they are facilitated at a center where they're able to do their core subjects, pretty much in all the parishes. So we have 14 parishes here in Jamaica. And we are able to facilitate these students until after their pregnancy, where we would then try to get them back into their traditional schools. The second component that has added to the success it has garnered over the years is that with parental consent, we have been offering long-acting reversible contraceptives to our girls, primarily Jadel, that's the implant, and the IUD, otherwise called copper T here in Jamaica. We have Marina, which is a hormonal one, but that is not what we offer through the healthcare system. So why this is important is because for girls under 16 years, given the issues with access to SRH information, goods and services for minors under the age of consent, this is important because with this program, we're now able to do something that many other entities are not able to do, which is to provide service to girls under 16. So the two negatives that have come up as threats to the program, which we have now resolved, one being that initially with the pilot project, obviously it was just in one parish. And now we have expanded that, decentralized it to all of the parishes in the country. And in addition, we have expanded the offerings or the interventions that are offered through the program. So due to that, now we now have a greater level of availability and accessibility to our girls who are pregnant. Though there is some need for an expansion of this because we do have some girls in more rural areas who are not able to benefit as well from the program as we'd want them to. But the hope is that in the years to come, we'll have a greater expansion of this in the more rural areas so that we can benefit our girls in a better way. The other thing that was initially a challenge, but we have overcome, is that back in 1980, the policy that existed that time stipulated that when girls sat out of school due to pregnancy, it was left to the discretion of the Minister of Education whether they would return to school or if they could even return to that particular school that they left from. However, in 2013, based on the input from the Women's Center program and just other NGOs who have been working assiduously to assist our girls, a policy was put in place, which is entitled the National Policy for the Reintegration of School-Age Mothers into the Formal Education System. Now, what this policy does is to kind of set forth a framework for how our girls would leave school to enter the Women's Center program and how they would be able to re-enter the traditional school system, whether it is at the same school that they left from or another school in that particular parish. So that policy has made a world of difference when it comes on to benefiting our girls and to make it easier for them to transition back into school to complete their education. So these things have definitely aided in the success of the program and why it is now a mainstream government-funded program that the entire country is very proud of. Thank you so much.
Thank you very much for your valuable contribution. We now have our fourth guest representing the Chilean Ministry of Health. We welcome Francisca Salas, whom we ask to respond to this question. Since Chile is one of the countries in the region that has shown the greatest decrease in teenage pregnancy in the region, could you share your analysis of which were the 3 interventions by the Ministry of Health and which strategic pillars account for this success? Thank you very much. I wish to thank the invitation to this celebration and responding to questions. I wanted to tell you that in the strategies, there are 3 main pillars. One is to improve access. The second is to improve the distribution of contraceptive methods. And what has been done through these years in this millennium, in 2008, we had 54.9% teenagers in that age group. And we then started working on better access to health control, to comprehensive adolescent health control. There was an interdisciplinary action that contributes to improve protective factors including the prevention of teenage pregnancy. The strategy was through friendly spaces, which are differentiated with an equitable, confidential management, different times, information, and guidelines. And it was implemented as a pilot program in 2008, but it was implemented fully this last decade with emphasis on sexual and reproductive health and mental health. We have 64 establishments. 100 of them are inside educational establishments. In the strategy and aligned with the objectives of the Andean Plan for the decrease in teenage pregnancy, and together with this, we generated the consultative space of adolescents with the participation of adolescents in the micro fund, but also regionally and nationally, and they collaborate with improving access regarding better distribution of contraceptives, and within the national health strategy, which has a mandate for the reduction of teenage pregnancy, and regarding our new rules regarding health services, regarding fertility regulation, the access to contraceptives has improved. And as the colleagues have mentioned, including the long-term and also emergency contraception, which is more fluid since 2010. Finally, the networking, which allows continuous training of our human resources. The health network is articulated at 3 levels: primary, secondary, and tertiary care. The 3 levels are articulated in each region, and finally, there is an articulation that reaches the central level and at the primary level, where the strategies are implemented for pregnancy prevention. It has a community and family health system, which allows to have a life cycle outlook. This integration allows us to send information from the central level to regional secretaries and health services, and that has allowed Chile to decrease its rates from 2008 of 54.9 to 22.5 nowadays, and according to age groups, now 11.9 in the population of 15 to 19. Thank you very much. Thank you very much, Francisca, for this analysis that you have provided from our sister country, Chile, and for your participation and valuable contribution. Our fifth guest will provide a complementary view as a young member of parliament, member of the young parliamentary members in El Salvador, the MP Anabela Veloso. The question is, in Latin America, we have worked for years in the prevention of teenage pregnancies. And in your view, as a young member of parliament, it is important to know, considering the El Salvadorian context, what have been the main barriers in the legal framework for improving the access and coverage of sexual and reproductive health services and contraceptives in El Salvador, and what are the initiatives that are underway now? Thank you very much, Leah. Good morning to all of you. It's a pleasure to participate in this webinar regarding CLAP's 50 years. I have listened attentively to all the participants and how from our region no, that yes, I can hear her perfectly well. Yes, we hear her well. Thank you very much. Good morning to all of you. To thank you for the space and the invitation. It's an honor to be part of this webinar. I wish to say that, as has been said, the issue of pregnancies of girls and teenagers is an important problem in our region, and particularly in our country. Although there have been some advances, it remains a problem limiting the full development of our girls and adolescents. So having a legal framework is fundamental, but in our country, being able to have a comprehensive education in sexuality is still a challenge. I must say that we are still facing in our country some obstacles because there are voices that do not agree with these issues, particularly based on issues on life, Christian values, or leaving aside the lay character of a state, particularly when our country's constitution insists that we are a lay country and non-confessional country. And the conservative sectors in our country have arrested the development of this. But I must say that there have been efforts, and since the 80s, there have been efforts to introduce the subject, but it has been insufficient, and we must say that up to now, we do not have a law of sexual education for our children and adolescents. So this vision is opposed when we try to advance in these subjects. As a young member of parliament, I must also say that in our group of young parliamentarians, we have in this session that is almost finishing, we have included as a priority issue the reduction of pregnancies in children and adolescents, and we have been helped by UNFPA, and we have developed different initiatives. This space from the Salvadorian Parliament is a plural space with representation of youngsters of different political parties in the country. So we saw that the use of this plural space could be used strategically to make this issue more acceptable and to be discussed from an outlook of rights and public health. We have thus been able to move forward and submit initiatives also in coordination and with technical support of UNFPA to propose, and we did so at the beginning of this year, a framework law for comprehensive sexual education, which tries to bring together all these experiences through comparative legislation where it exists, so that every institution in society, starting with the family, that they may understand the responsibility we all have in the care of the well-being of our children and adolescents. And conservative voices usually say that nobody else must educate their children but the family. So this proposal is now under study in the legislative. We have not seen it approved yet, but it is a fundamental step in another symbolic initiative that we just submitted to declare the last week of September as the week for the prevention of pregnancies in children and adolescents. It exists in other countries. We hope to have positive results. It doesn't mean that there isn't anything in law. Of course, there are legal frameworks that mention it. For instance, the law of protection of children and adolescents, the education law, but there is no comprehensive framework. And that is what we are now trying to promote. And with the youth parliamentary group, we would like to leave that legacy for our children and adolescents and the youth and the country in general that would allow us to set the basis for the elimination of this severe problem that attacks the lives of our children and adolescents. This is the time I have, so I will close here. Thank you very much for the support and for the space and the support of international agencies in our countries to keep moving forward in the reduction and elimination of pregnancies in teenage. Thank you, Annabella, for your valuable contribution. Our next guest will present the view of an important Caribbean NGO. So please, again, adjust the interpretation because her comments will be in English. Donna Acosta Martinez, Executive Director of the Family Planning Association of Trinidad and Tobago. We are aware that NGOs such as family planning organizations have had a very important role in the increase of access to sexual and reproductive health services for youngsters in order to reduce the rate of unintentional pregnancies in teenagers. What can we do to bring together governments and NGOs so that they can accelerate the process together? Would you please share 3 lessons learned in Trinidad and Tobago?
Thank you very much, Leah. Good morning to everyone. I would like to start by thanking the organizers for the opportunity to share my perspectives and lessons with you. Young people's right and access to sexual and reproductive health information and services has always been a principal mission and cause for the Family Planning Association of Trinidad and Tobago for over 60 years. It is a significant issue that we feel passionate about and will continue to advocate until the sexual and reproductive health needs of our young people are met. Let me start by talking about the differentials with approaches and the ongoing narrative of establishing a standard of what is the right approach to comprehensive sexuality education for our young people, and often not involving those who stand to benefit the most. When we consider the sexual and reproductive health landscape, in recent times, Trinidad and Tobago has approved the National Sexual and Reproductive Health Policy, which we're very proud of. We've amended the Children's Act to safeguard our children from sexual abuse. We have recommendations from the Equal Opportunities Commission to facilitate young people's access to sexual and reproductive health. And we have participated in and developed the first Caribbean Congress on adolescent and youth in championing our wealth, promoting the health and well-being of adolescents and youth in the Caribbean, a roadmap. In spite of these developments, we are yet to arrive at a consensus on what should constitute comprehensive sexuality education, as it is more commonly called health and family life education. Depending on where you stand and who you engage with, that agency has their version of a justifiable position on critical information that young people need. In many instances, these positions are taken without the involvement of those who stand to benefit the most, our young people. This has created a lot of contention on the public front, and we continue to see divisions with approaches. Our government says there's a program in place, yet our teachers say they are not trained to teach it, and it should be done at home. Parents say they don't know how, and they depend on the school. Religious bodies say it's covered in the religious texts. Many NGOs say it's insufficient, and what currently exists isn't practical, and most importantly, our young people say their voices are not heard. In FPAC's experience, what we have found work best is when we involve the parents, the school, the children, and all the other NGOs and religious bodies in the education program. So we do have an opportunity to leverage these partnerships to ensure that young people are not denied access to what is their right, the right to sexual and reproductive health information and services. However, we have an even greater opportunity now. Our Prime Minister, in his most recent budget speech, said that the education system needs to be revamped. This means that we, the ones who serve young people, the ones who engage young people, need to speak up and in unison with young people. We need to speak from an objective place and not one based on personal and individualistic biases. Our reality is that young people need the knowledge and skills required to make competent decisions relating to their sexual and reproductive health. We already have the tools. Our next step is exercising our political fortitude to act on these strong tools and frameworks that were built. Note, however, This can only be realized if we stand hand in hand, working together with and in the interests of young people. Meaningful actual partnerships is a lesson and a way forward. Since its inception, minors' access to SRH has been a contentious issue that FPAT passionately addresses. As a service provider, it is easy to say that FPAT has seen it all, but every once in a while, there is an unfortunate situation that is presented to us that beats the one before. What is consistent, however, is that there is a significant gap between and among policies, procedures, and the law, and minors' access to sexual and reproductive health services. Through our clinics, we validate findings such as 29% of young people 13 to 17 years are sexually active. We hear directly from those we serve that the people who abuse children don't care about how old they are. They are sick people. The law is about age of consent is not going to stop them. It only stopping me from getting help. I need to take care of me. Given the gaps with policies, procedures, and the law, FPAT has had to establish key relationships with agencies such as the Ministry of Health, Children's Authority, Trinidad and Tobago Police Service, Rape Crisis, and a number of other NGOs to address the unmet need of minors' access to SRH services. It is this national community working together in the interest of the well-being of the child that will bring resolve to many preventable and unfortunate sexual and reproductive health experiences faced by minors. There is a need to solidify these relationships, which should guide a national agenda and response. To end, we have a saying at home here in Trinidad and Tobago, that while the grass is growing, the horse is starving. It means that we need to act now as we stand to lose our greatest and most precious assets, our young people. It is time to start acting on the promises we've made and realize the sexual and reproductive health needs of our young people. I thank you for the opportunity to make this intervention.
Thank you, Donna, for your very valuable contribution. Our next speakers will give us the outlook of the young and adolescents, and they will give us their view of the regions of the Caribbean and Latin America. Please, we request you to please by your 4 minutes. We have Joe Bennett Silva Gonzalez, representative of the Start of the Rainbow of Colombia, John Kenneth Silva, who will give us one of the views of a broad and diverse Latin America. John, what are the 3 main barriers that the young face in Colombia, preventing their key interventions for adolescent pregnancy, such as the involvement of males in the prevention of adolescent pregnancy, access to comprehensive health services, and the access to long-action contraception in Colombia? Well, I wanted to especially greet all the participants at this webinar that is gathering us today. First of all, let me thank you for the invitation from UNFPA, and I especially want to tell you about the rurality. That is one of the sectors in Colombia that is most neglected in terms of public policy and government actions. And one of the things that we see is that there's no such thing as a comprehensive sexual education, because we don't see any sexual education classes at schools. We see that the topic is not discussed up front, and as a non-governmental organization, we work from 3 lines of action. One is education, and we work strengthening life projects to prevent gender-based violence. Because when we touch upon topics related to adolescent pregnancies, we need to speak of violence and the harmful practices against our boys and girls in our communities. So the first thing that I'd like to say is that there's a lack of comprehensive sexual education, and we have a lack of public policy in our legal framework. And first of all, there's a lack of education in the health and education entities to deal with adolescent pregnancy and sexual abuse. And second is that in the public policies, the public policy makers are the ones who should consider the purchase of long-action contraception. There are many people in the urban areas that have access to healthcare, but 2 hours away from urban areas, people don't even have a transportation, and they can't have access to contraception services. That is one thing. And second, we see that that harmful practice of the early intercourse that lead to adolescent pregnancy. These are traditional practices that have been going on and on for generations and generations among the peasants in our area. So one thing leads to the other. And as an NGO, we have seen many cases there. And the third that we share with Latin America is one of the indicators of is those lacks of spaces for strengthening and leadership. And I think that is one of the reasons why we can't act on teenage adolescents. Not only do we have to provide contraception methods, but we need to strengthen the life projects of the girls, boys, and adolescents in our territories to help them see what they expect of life. And it's not just an issue of asking the child, what would you like to be as a grown-up? And they may say, well, I'm going to be a doctor or a lawyer. No, we have to reach to the basic and linking it to the context of adolescence in our territory. And as an organization, we can say that it's thanks to the strengthening of the life projects of the youth that we have 15 young people in our community that had access to their universities. And clearly that has driven change in their families, and that trickles in their families. As another measure, as an organization, we work comprehensively with children, girls, boys, adolescents, and mothers. At present, we have a group of 11 mothers, and we develop a production method to deal with all gender-based violences, but they go home and they replicate everything that we discuss at the workshops, because clearly if we give the guidelines and we tell them about the activities to girls, boys, and adolescents, and then they go home with more hostile settings, clearly everything we did has been lost, because again, they're going to feel that they are oppressed by the existing system. But if we work as groups with children, adolescents, and mothers, most of whom are family heads, we work with them for in the area of contraception, and that is more or less what we do. Thank you. Yes. John, thank you. And closing our initial part, we wanted to introduce a young representative of the Caribbean who will speak English. So we request you to once again click on the interpretation. Hello, Kimberly Gilbert of the Network of the Caribbean. We often say that the involvement of youth is essential. Do you think that this is happening in the Caribbean? And what are the 3 key actions that can be taken to the young? How can we promote the engagement of youth in a systematic and sustainable manner? You have 4 minutes. Thank you.
Thank you very much, Leah, and it is a pleasure to be a part of this webinar. I must thank the organizers for providing me with this opportunity to share with you all today. Indeed, we often mention that youth participation in sexual and reproductive health is critical. You know, nothing for us without us is what, you know, we youth say. And of course, it is proven that, you know, active youth participation significantly improves the impact of the interventions made. So yes, youth participation in sexual and reproductive health is happening. You know, for example, we have the youth advisory groups that UNFPA has in different countries. However, the efforts made by UNFPA and other agencies and other young persons who are involved in sexual and reproductive health education must be amplified. Currently, it occurs largely in a vacuum, and work is being done in silos sometimes. So youth sexual and reproductive health needs must be mainstream and not kept, for example, only in the Ministry of Health. You know, other ministries can take some aspect of responsibility, such as the Ministries of Education or Family and Social Development, Ministries of Culture, Finance, Labor, etc. This mainstreaming is necessary. I can also say that, you know, as a UNFPA Youth Advisory Group member, there is opportunity to do so, as I mentioned before, and we do provide feedback on various policies. However, I believe that larger consultations with young people and larger facilitation of sexual and reproductive health within these policies is needed. You know, additionally, there needs to be strengthening and amplification of regional collaboration and partnership. Youth need tools. We young people also have to play a significant role in getting this done, because we cannot sit back and always ask for something. Sometimes we have to get up and take it ourselves. So, you know, youth, we need to use the tools and opportunities that are accessible in order to meet our peers where they are. You know, we should use our innovative abilities to formulate material to engage and educate our peers on various platforms. And we know that with the advent of social media, for example, there are numerous platforms and a wide number of young people that can be reached. There is a need to strengthen the relationship between youth and the allies that support their education of SRH, as well as their access to SRH services. And I believe that we are well on our way to achieving enhanced and coordinated participation in SRH. And I could provide one example. In October of 2019, I know, as mentioned before by Mrs. Donna Acosta Martinez, we had our first Caribbean Youth Health Congress on adolescent and youth health. And at this event, there were over 150 youth from across the region who attended and participated and shared their lived experience as well as their expertise. And from this, a roadmap was developed to address adolescent and youth health. And this was launched recently during the commemorated Caribbean Adolescent Pregnancy Prevention Week. Of course, this is only a drop in the bucket and must be followed by actions on the recommendations provided in the document by the adolescent and youth of the region. And can more youth get involved? Definitely. There is a need for more young people to get involved, to be trained in sexual and reproductive health and rights, so that they are able to reach their peers and provide the relevant guidance that is needed. As for the important actions that young people can bring to the table, peer education. We need an informed populace of young people who understand what their rights are, to understand sexual and reproductive health through the administration of comprehensive sexuality education, and also who understand the legislation and policies that speak to their sexual and reproductive health and access to services. For example, one of the events that we had during the Adolescent Pregnancy Prevention Week was the Youth Our Truth discussion. And a young woman who became pregnant in her teenage years, she also mentioned that it is priority to educate young people, and the adults in her lives were not educating her. If it is that we have young people who are equipped with the information and able to educate their peers, then this is a method with which the information can be passed on. Because as you know, we would have heard just a short while ago again by Mrs. Martinez, is that the responsibility for sharing information is like they're playing hot potato with it. The government pass it on to the teachers pass it on to the parents pass it on to religious institutions. This is something that needs to end. Also, secondly, there needs to be collaboration and partnership with allies or agencies that are supporting adolescent and youth health, such as PAHO, UNFPA, and these ministries of youth, but it must also include a lot of youth. And I must, I cannot exaggerate enough the input that young people must make in these processes. Again, I call thirdly on young people, because we must be willing to take the lead in the advocacy and implementation of sexual and reproductive health measures for our health and for a positive future. Their advocacy, or the advocacy of young people and the activism of young people, is critical. In terms of fostering youth participation in a sustainable way, this can be achieved by creating the environments that facilitate youth advocacy and activism, by legislating and standardizing comprehensive sexuality education in schools, by training the professionals in the field of SRHR and rights. This can be accomplished through collaboration with youth and allies and so forth, as mentioned before. There also needs to be establishment, I believe, of a platform or a system that makes information available, and it's very consistent, in providing this information, even to rural and hard to reach areas within countries. There needs to be access to information and services, and I cannot stress that enough. Additionally, there needs to be a lot of work done. Like I said before, the roadmap was introduced, and that is just a drop in the bucket. There needs to be action based on what the key action items would have been in the roadmap. This needs to be acted on. And we also need to possibly increase capacity building, such as trainer programs for young people, so that we're able to share the information with each other, as well as standardized monitoring and evaluation of interventions. And I say standardized because if organizations are capturing data in different ways, again, this can enhance the silos with which things are being done. Rather, when it is standardized, we can come together as a region and pool the information and see which areas really need development and what are the interventions can be done to make that happen. We have too many policies and bodies, but very little implementation. We have to act, we have to be resilient, and we cannot afford to stop. Thank you very much.
Thank you very much, Kimberly, for your valuable contribution. I thank all the panel members for their analysis, reflection, initiatives, and perspectives that they have contributed. I now go back to Vicky and Rodolfo, who will coordinate questions. I'm very thankful. We are very sorry, because with so much passion and so many contents and good things to share, we are already very late. Unfortunately, we shall not be able to generate a space for discussion, but there is a set of questions that we shall try to respond together with Vicky and Sonia and respond to them. To finish, I would like to mention one of the questions on how to maintain in changing governments, how to keep this mystique that Silvina talked about and this commitment. The answer would be to try to maintain one of the secrets that we saw throughout all these positive experiences, to maintain agents who are committed and with competence, states that have a capacity to innovate, to integrate education sector and legislative sectors with spaces for information and education. Nothing for them without them, including adolescents in monitoring quality of services, and that has demonstrated throughout these experiences to be one of the central elements that I would like to stress. This way, we also respond to how to take care of the mystique by generating these spaces that we have tried to generate. Vicky. Hello. Well, I will be very quick because of the time, but I was looking at the questions and one of them relates to access to contraceptive methods and to make them available for youngsters, particularly long-acting ones. We know one of the effects, the more negative effects of the pandemic has been the disruption of the supply chain of contraceptives. And in UFPA, this is an important area of work for us as an organization. We have been working with countries in order to find mechanisms that help countries to have a variety of methods during the pandemic. Likewise, another strategy that we have been working on in the region is to ensure that health providers have all the options to replenish methods. If you are using an implant and there isn't one available, well, to find alternatives that could be good for that. For instance, Depo-Provera during the pandemic until these methods are available. But from UFPA, we are supporting a regional strategy that has to do with long-lasting methods. We started introducing them many years ago, the subdermal implants in several countries in the region. Uruguay was one of them. We also supported Argentina, Chile, several countries, Costa Rica, but nowadays we have a regional strategy that has to do with scaling up of the IUD in the countries of the region.
The IUD used to be the first method of choice among the modern contraception methods. However, its prevalence has reduced significantly in most countries. So it's not a matter of repositioning the IUD, but to rescaling it, a scaling up strategy. And this is a work that at present UNFPA is implementing with several governments in the region. So I could answer that as part of the efforts during the pandemic and given the lack of supplies in the methods. So focusing on 3 areas: retraining the staff, having alternatives for contraception methods, and third, having well-organized strategies. So that is what I wanted to say. And let me just highlight one single message, the take-home message that I want to leave as part of this effort. In the countries, and many of the countries still have the DIA committees. Those are the committees that work in the supply and ensuring the supply chain, not just in procurement, but so that the supplies may reach the last mile. And those committees are more important than ever to assure availability of contraception methods. And finally, I want to say goodbye, and I want to thank all the colleagues that have been here in the panel. I think it has been very enriching, and it's a pity to have to close it now. However, I want to highlight 3 items that I think that can be drawn from the presentations. The first has to do with a multisectoral approach. You don't not just understood from the standpoint of education, but also from other sectors, including the work that is being done with the lawmakers, changing the legal frameworks, which is very significant so that the people may make really enjoy in their rights. Well, thank you, Vicky, for your words. Now we only have 1 minute later for the streaming, so we have to give the floor to Sonia. So thank you for your words. Please open your cameras because we are going to say goodbye all together. And to thank you, Sonia, please, you have the floor.
Yes, thank you very much, Vicky. Thank you, Susanna. And my last minute, I want to just emphasize what Joaquin has said in his question and his comment that reinforces what many of us already said, is that we need to address the underlying conditions and barriers, and gender is definitely an important, gender inequity is definitely an important issue to incorporate in our efforts to reduce adolescent pregnancy. And that's why I think what Vicky said about a multi-sectoral approach, ensuring that we have evidence-based interventions, but also ensuring that we address the barriers and the underlying power relationships that reduce the access of adolescents, women to information, to services, to decision-making are critical for us to move forward. Thanks, everybody. It was very enriching, and I wish everybody the very best.
Thank you. Take care.
Thank you. I want to thank you all for your work, especially the young that are here and those in the countries. It fills us of hope to see so many people passionate about what they do. And thank everybody here of PAHO and the other agencies. We have more than 200 participants, the interpreters, and especially 3 people that have worked so hard for all this work that is underlying. Rodolfo Gomez Ponce de Leon, our regional advisor, and Sonia Cafe, and Ana Artigas, who's our communicator. Thank you all. And now we put an end to the streaming, and we thank you for all your participation. And we hope to receive you at home at CLAP. Thank you for joining us in the celebration of our 50th anniversary. Goodbye.